Hello everyone. It's so great to see you all again. To be honest, today I want to talk about something we might often forget, yet it's incredibly important. It's about an organ that works so hard inside our bodies, but we rarely give it special attention. Yes, that's the kidney. This topic is especially relevant for those of us with parents and grandparents at home, or for those of you who are entering your golden years. We often dismiss aches, pains, or easy fatigue as just a part of getting old. However, these could be an alarm from our kidneys that they need help. In this video, we'll break down why senior kidneys need extra attention, how to care for them if they're already sick, and most importantly, how to keep our kidneys on fire well into old age. Why do senior kidneys get sick easily? To make it simple, imagine your kidneys are like a water filter at home. Over time, that filter gets old, right? Parts of it start to wear out, and its function becomes less optimal. The same thing happens to our kidneys. As we get older, kidney cells begin to lose their function. It's natural, considering they've been used constantly our whole lives. Additionally, many seniors have diabetes or high blood pressure. These two diseases are the arch enemies of the kidneys. High blood sugar damages the small blood vessels in the kidneys, while high blood pressure forces the kidneys to constantly rev up until they get exhausted. This is because kidneys have millions of tiny filters called glomeruli, which are made of small blood vessels. When blood sugar is consistently high, like in diabetes, the walls of these small blood vessels thicken and harden. One more thing, sometimes we take medicine for various ailments. Some of these, especially over-the-counter pain relievers, can be a heavy burden on the kidneys if taken continuously. So, just imagine, a kidney that's already starting to get old still has to deal with the two big troublemakers, diabetes/high blood pressure, and is then bombarded with medication. Can you see why it's so susceptible to sickness? If your kidneys are sick, how do you manage it? Okay, if someone has been diagnosed with kidney disease, don't give up immediately. This is not the end of the world. There are many ways to manage this condition. 1. Have a chat with your doctor. Most importantly, don't run from your doctor. Talk to them, ask them everything, and follow what the nephrologist, kidney specialist, says. They are your best partner. The sooner kidney problems are identified, the greater the chance to control and slow down the damage. 2. Kitchen revolution. When your kidneys are in trouble, your kitchen becomes the main battleground. You have to regulate your diet. From now on, reduce salt. Delicious food doesn't have to be salty. Try using spices or other natural seasonings. Salt makes your body retain fluid, raises blood pressure, and puts a strain on the kidneys. As for protein, it's essential for the body as a building block for muscles, hormones, and tissue repair. But when the kidneys are sick, protein becomes a problem. The end result is waste that needs to be filtered out by the kidneys. If there's too much protein, the already weak kidneys have to work extra hard to filter out this waste, and over time, the damage gets worse. 3. Watch out for phosphorus and potassium. Why be cautious of potassium and phosphorus? These two minerals are important, but for people with chronic kidney disease, CKD, the kidneys can't remove the excess potassium and phosphorus. Before we continue, I'll explain what potassium and phosphorus are and what their functions are. As we know, potassium and phosphorus are essential minerals that work together to maintain overall body health, from cell, nerve, and muscle function to bone, heart, and metabolic health. Potassium and phosphorus are vital for normal kidney function, but levels that are too high or too low can be dangerous. An adequate intake of potassium and phosphorus can help prevent kidney stones and maintain health. However, in people with chronic kidney disease, CKD, the kidneys cannot remove excess potassium and phosphorus, which can lead to hyperkalemia, high potassium levels, and a dangerous buildup of calcium in the blood vessels, which is bad for the heart and worsens the kidney condition. Conversely, a lack of potassium, hypokalemia, and phosphorus can also affect kidney function and cause various other problems. What should you do? You have to pay attention to your food choices. Limit high potassium foods like certain fruits, bananas, avocados, oranges, and high phosphorus foods like processed meats. But don't worry, there are tricks to reduce their levels. Four, manage your fluid intake. Water is essential for the body. But if the kidneys are already in trouble, fluid intake must be carefully regulated. This is the most important principle in managing fluid intake for people with chronic kidney disease, CKD. There is no single answer that fits everyone regarding how much fluid to drink. Stage of kidney disease. In the early stages, there may be no fluid restrictions. However, in advanced stages, especially stages 4 and 5, fluid restriction becomes very important. Clinical symptoms: the presence of swelling, edema, in the legs or face, shortness of breath, fluid in the lungs, or high blood pressure will lead to stricter fluid restrictions. General formula as a guideline: doctors often use a basic formula to calculate the daily fluid needs of patients in advanced stages. Daily fluid intake equals 24-hour urine output plus 500 milliliters. The 500 milliliters is added to replace fluid lost through invisible processes, called insensible water loss, such as sweat and breathing. Example: if a patient only produces 400 milliliters of urine in 24 hours, the doctor might recommend a fluid intake of 400 milliliters plus 500 milliliters equals 900 milliliters per day. Important: if a patient cannot urinate at all, anuria, fluid intake may be strictly limited to around 500 to 800 milliliters per day. Use a measuring cup. Prepare a bottle or cup with a determined volume for your 24-hour fluid allowance. This helps you control from taking in too much. The exact amount of fluid you should drink must be determined by a doctor or a nutritionist. Always consult and follow their advice to avoid dangerous complications such as fluid buildup in the lungs and heart. 5. Control the two big troublemakers. Keep taking your diabetes and high blood pressure medication as scheduled. Think of this as a way to tame the big troublemakers so they don't cause any more problems. Controlling blood sugar and blood pressure won't repair existing kidney damage, but it's very effective at slowing down the rate of further damage. As explained earlier, diabetes and hypertension, high blood pressure, are the two main and most common causes of chronic kidney damage worldwide. Both damage the kidneys slowly but surely, often without symptoms in the early stages. Troublemaker number 1. Diabetes, high blood sugar, how it damages. Imagine the kidney filters, glomeruli, as a very fine strainer. Consistently high blood sugar makes the blood thicker and stickier. This thick blood forces the kidney filters to work extra hard. Over time, these fine filters get damaged, inflamed, and leak. An early sign of this leakage is protein, albumin, in the urine. Over time, this damage becomes permanent, and the kidney's ability to filter out toxins drastically decreases. Role of diabetes medication. Diabetes medication, both oral and insulin, works to keep blood sugar levels within a normal range. With controlled blood sugar, the workload on the kidney filters is reduced. This significantly slows down the rate of damage to the filters. Troublemaker number 2. High blood pressure, hypertension, how it damages. Imagine the blood vessels in the kidneys as millions of tiny pipes. High blood pressure means there is a very strong and constant blast of blood hitting the walls of these pipes. This strong pressure will damage and weaken the walls of the blood vessels in the kidneys. As a result, the blood flow that carries oxygen and nutrients to the kidneys is disrupted, causing the kidney cells to die slowly. The vicious cycle. Kidney damage from hypertension can create a vicious cycle. Damaged kidneys can no longer help regulate blood pressure well, which in turn makes blood pressure even higher and kidney damage even worse. Role of high blood pressure medication. High blood pressure medication, antihypertensives, works by widening blood vessels or reducing the force of the heart's pump, which lowers the pressure on the pipes in the kidneys. This provides vital protection for the kidneys from further damage. Taming means slowing down the damage, as in the quote, "Taking medication regularly is our way of taming these two diseases." The goal is prevent worsening. Controlling blood sugar and blood pressure won't fix the existing kidney damage, but it is very effective at slowing or even stopping the rate of further damage. Maintain kidney function. The goal is to keep the remaining kidney function for as long as possible. Delay the need for dialysis. By controlling the two big troublemakers, patients can delay the time they need to start kidney replacement therapy like dialysis or a kidney transplant. The bottom line is that adherence to taking diabetes and high blood pressure medication on schedule is the main foundation for managing chronic kidney disease. Ignoring it is the same as letting the two big troublemakers continue to cause trouble and damage the kidneys without control. 6. Just take a walk. Keep moving. You don't need to run a marathon. A morning walk around the neighborhood, light yoga, or Tai Chi are already great for improving circulation and maintaining health. Consistent, even light movement provides tremendous benefits for the physical and mental health of chronic kidney disease patients. Why stay active? Chronic kidney disease, CKD, patients often experience fatigue due to anemia, loss of muscle mass, and a lack of motivation. If they just stay still, this will create a vicious cycle. The more tired they are, the less they want to move, and as a result, the body becomes weaker. Real benefits of just taking a walk. 1. It helps tame the two big troublemakers. Blood pressure control. Regular physical activity helps blood vessels become more elastic and can lower blood pressure, easing the burden on the heart and kidneys. Blood sugar control. For diabetics, exercise increases the body's sensitivity to insulin, which helps control blood sugar levels more effectively. 2. Heart health and circulation. Heart disease is the biggest risk for chronic kidney disease, CKD, patients. Light exercise strengthens the heart muscle, lowers bad cholesterol, LDL, and raises good cholesterol, HDL. Better blood circulation means every organ in the body gets an adequate supply of oxygen. 3. Increases muscle strength and energy. Prevents muscle wasting, which is a common occurrence. With stronger muscles, patients will have more energy to perform daily activities and won't get tired as easily. 4. Better mental health. Physical activity releases endorphins, hormones that make you feel happier and more positive. This is very effective for fighting stress, anxiety, and depression that often accompany chronic illness. Sleep quality will also improve. 5. Maintains bone health. Light weight-bearing exercise, like walking, can help slow down bone loss, another complication of chronic kidney disease, CKD. Important warning: doctor consultation is key. This is the most crucial part. Before starting or changing an exercise routine, patients must consult with a nephrologist or their medical team. How can we prevent kidney sickness? Now, this is the best part. Rather than treating, it's better to prevent it from now on, right? Whether you're young or old, these tips apply to everyone. The easiest thing is to drink enough water. Kidneys need water to clean out waste. Think of water as the kidney's soap. Make sure your urine is clear or a pale yellow. Check yourself. Don't be lazy about checking your blood sugar and blood pressure. Think of it as our health report card. If there's a red mark, stay away from excessive salt and sugar. You already know this, but reduce instant foods, sugary drinks, and salty snacks. This is a true long-term health investment. Be careful with medication. Don't just buy medicine without knowing its effects. Ask a pharmacist or doctor first. Some pain relievers, if consumed excessively and for a long time, can wound the kidneys. Let's get moving. You don't have to go to the gym. A leisurely walk, cleaning the house, or gardening all count as exercise. The important thing is that your body is moving. Don't hold your pee. If you have to go to the toilet. Don't hold it in. Holding your pee can cause an infection that can travel up to the kidneys. You get an annual health checkup. At least once a year, get a health checkup. All you need is a blood test and a urine test. This is the most effective way to get an early detection. The best way to peek into the condition of our kidneys is through simple lab tests. The two key tests are blood test, creatinine, to see how well the kidneys are filtering waste. Urine test, albumin, to see if there is a protein leak, an early sign of kidney damage. Early detection is the key to preventing more severe damage. Think of it as an annual service for our most valuable organ. Taking care of our kidneys isn't as difficult as we might imagine. With a little daily attention, our kidneys will love us back. We can enjoy our old age in a healthier and happier way. If you have parents at home, try inviting them to watch this video with you. Encourage them to take morning walks, make them healthy food, and accompany them to their doctor's appointments. Our support is incredibly important to them. Let's make our golden years a time for fun, not a fight against disease. Take care of your kidneys, and your kidneys will take care of you. If you found this video helpful, don't forget to like, share, and subscribe. See you in the next video.